by the people, for the people. The gathering to get health care now. Chapter 24, Popular Health Plans in the Market. ACOs are physician medical care organizations which have a triple aim: better health care for the populations they serve, better care for their individual patients, fair and reasonable prices that will be better in the open markets. They're based on attributions of patients from primary care physicians, those who are trained to diagnose and to treat and coordinate the care of most patients. These are family practitioners, internists, general practitioners, naturopaths, masters and doctors of Eastern medicine and acupuncture, nurse practitioners, and pediatricians. These PCPs usually refer to about 30 different types of specialists. They have monthly payment plans for the PCPs and specialists that are, number one, retainer payment agreements, and number two, fee-for-service at fair and reasonable rates. Sometimes there are bundled payments from health plans that are the equivalent of the retainer plans and the fee-for-service. Performance bonuses for providers are based on about 50 to 100% of the cost savings compared to the market rates for professional, hospital, and ancillary costs of medical care. Medicare bonuses are paid annually. Commercial health plan bonuses are paid quarterly. The quality measures are equal to or better than the professional standards. Medical outcomes are better than the community averages. Electronic medical records are kept, and the encounters, services, and diagnoses are coded correctly. Patients have access to and can easily share their medical records. Patients are satisfied with the advice, care, and treatment from their physician and his or her staff, and the staff members at the facilities to which they are referred. Credentials are in order and up to date. Now, there are some gap healthcare plans. Most healthcare encounters don't require insurance, but they can be handled between the patients and their physicians more efficiently and less expensively, as in our monthly payment plans. However, if there's a major medical problem that requires multiple providers and hospitalization, then insurance and cost-sharing pools are very helpful. There are 3 examples of plans used by our PPC members. Indemnity plans. They reimburse for professional services at fair and reasonable rates based on the published fee schedule, like Medicare fees used by the government. Reimburses about $1,000 a day for outpatient services and $2,000 a day for up to 20 days for inpatient services. Then the employers often sponsor plans under the Employee Retirement Income Security Act, and they form trusts that benefit the patients, and in conjunction they buy stop-loss insurance and make contributions to pay for professional and hospital services at Medicare rates or slightly above Medicare rates in some cases. Plan designs we recommend are to prepay primary care, lab, and imaging so that they have no co-payments or deductibles. Then there's a copayment for hospitalizations of $500 per day. However, the insurance has stop-loss coverage, and the maximum out of pocket is about $6,000 per person per year, with $12,000 being the maximum for the family. Coverage for catastrophic losses for the employer and for their trust is about $5 million per person per year. Now, the cost of this plan for the employers is about $414 per employee. That is about 40% lower than the usual cost of indemnity insurance on a group basis. Now, there has to be some charity involved in this because not all people who are members will be able to carry their load. Now, it's the duty of the individual to try to cooperate and participate in their recovery and financial well-being so as to make charity spread among the rest of the members less burdensome. Now, there are health insurance exchanges in the market right now, and there are plans that are gold, silver, and bronze. And there are premium subsidies in the government programs for families with income levels up to 4 times the poverty rate. Gold plans pay about 90%, silver 80%, and bronze 60%. And the prices vary from $0 if you're poor to between $500 and $600 per person per month if you don't qualify for a subsidy. These government plans have an open enrollment period once a year.